Good evening, I'm Lynn Cannon, once again reporting from home. Tonight, Texas making its first step to try and reopen the economy. We know a lot of you definitely need to get back to work, but folks, this is not going to happen all at one time. The governor's saying it'll happen in stages with your health and safety the top priority. Let's check today's numbers, shall we? Right now, there are more than 6,500 people infected with COVID-19 in the Houston area. 117 people have died. 1,400 people have recovered. The governor stresses we need to keep practicing social distancing. He said it over and over today, from keeping schools closed to retail to go. Adam Bennett breaks down the game plan and what you can expect in the coming weeks.
Well, Lynn, Governor Abbott says he wants to reopen stores like these in a safe way without spreading the virus. He says it's a process that must be guided by data and doctors. He said a newly formed strike force of state officials and medical advisors will help him do just that. They'll work with business and community leaders like Mattress Mac, Tillman Fertitta, and Nancy Kinder. Monday, state parks will reopen. Visitors will have to cover their face, keep 6 feet apart from people they don't live with, and limit groups to 5 people or less. Then Wednesday, current restrictions on surgery will be loosened.
This will allow doctors to diagnose and treat more medical conditions without needing to get an exception. This one example of this would be a diagnostic test for suspected cancer.
The state will also enhance protections on seniors in nursing homes and assisted living centers.
We are requiring infection control policies, and we are minimizing the movement of staff between those facilities.
Then, starting next Friday, the governor will allow retail to go.
It will not allow people to go into these retail stores. It will simply allow them to be able to pick up items at a drive-through situation or delivery to their home.
And the governor says he'll announce more openings April 27th and in May, depending on the data and advice from his medical team. Now, he says those businesses would have to follow strict guidelines like occupancy and distance limits, requiring masks, and also more strict sanitation. Len?